Health officials here in Ontario saying there's no risk of the Zika virus being here right now after the discovery of mosquitoes that carry the Zika virus in Windsor.
It's the end of the season. Aedes aegypti will undoubtedly be killed off with the winter weathers.
Professor Fiona Hunter downplaying concerns about the discovery of larvae of the mosquito species responsible for the majority of the human cases of Zika in the Western Hemisphere. The discovery came as a bit of surprise. They were searching for more Aedes albopictus, which can transmit Zika. 4 of them were found in the Windsor area last month.
What actually happened was they found more albopictus, but they also found a few Aedes aegypti.
The big question now is, how did they get here? It's doubtful they are moving north. Hunter says there's likely a simpler reason.
Aedes albopictus and Aedes aegypti have come in cargo or in somebody's vehicle if they've brought home something from an area where Aedes aegypti and Aedes albopictus are present.
There has been growing concern over Zika in the last few years, especially in Brazil. For most people, it isn't an issue to be infected, but for those hoping to have a baby, there is the possibility it can be passed on and lead to birth defects such as microcephaly. One case of Zika has been reported in Windsor, but that person was infected elsewhere. And even though winter is expected to kill off the aegypti, we are not in the clear yet.
We're not 100% sure if Aedes albopictus will be killed off, and so working with Windsor Health Unit in the spring, we will resume enhanced surveillance.
All right, now the biggest risk of contracting Zika is still to go in an area where it is most common, and of course the most common areas right now, South America, the Caribbean, and Florida.